The Rohingya crisis is not a sudden eruption. It is a deep-rooted conflict fueled by decades of systematic discrimination and persecution. The Rohingya, a Muslim minority in Myanmar, have long faced oppression in their own country. Denied citizenship and basic rights, they have been subjected to violence, displacement and dehumanization. The situation escalated dramatically in 2017. A brutal military crackdown marked by unspeakable atrocities forced over 700,000 Rohingya to flee across the border into Bangladesh. This mass exodus, driven by fear and desperation, created a humanitarian crisis of immense proportions. The world watched in horror as stories of violence, rape and arson emerged. The UN called it a textbook example of ethnic cleansing. The Rohingya, stripped of their homes and livelihoods, were left with nothing but the clothes on their backs. Their plight is a stark reminder of the human cost of intolerance and indifference. The world must not forget the Rohingya. We must demand justice, accountability and a lasting solution to this crisis.
The arrival of hundreds of thousands of Rohingya refugees placed an immense strain on Bangladesh's resources. Overcrowded camps, lacking basic sanitation and healthcare facilities, became breeding grounds for disease. The most immediate threat was the outbreak of infectious diseases. Cholera, measles, and diarrhea spread rapidly, particularly among children already weakened by malnutrition. The lack of clean water and proper sanitation exacerbated the situation. Pregnant women faced heightened risks due to inadequate maternal health care services.
Trauma, both physical and psychological, cast a long shadow over the camps. Many refugees arrived with injuries sustained during their escape. Others bore the invisible scars of witnessing unspeakable horrors. Mental health needs were significant but often overlooked. The Bangladeshi government, aided by international organizations, launched a massive effort to provide emergency aid. However, the scale of the crisis was overwhelming. The world's response, while commendable, was struggling to keep pace with the ever-growing needs of the Rohingya refugees.
The international community, jolted by the scale of the Rohingya crisis, mobilized to provide humanitarian assistance. Aid agencies and NGOs poured into Bangladesh, setting up makeshift hospitals, distributing food and water, and providing sanitation facilities. The UN launched a massive appeal for funds to support the Rohingya refugees. Bangladesh, already grappling with its own development challenges, displayed remarkable generosity in hosting the refugees. The government, in collaboration with international organizations, worked tirelessly to provide basic necessities and prevent the crisis from escalating further.
However, challenges remained. The influx of refugees placed a significant strain on local resources and infrastructure. Coordination among aid agencies, while improving, was not always seamless. The needs of the Rohingya extended beyond immediate survival to long-term solutions. Funding, while initially robust, began to dwindle as the crisis became protracted. The world's attention, often fleeting, shifted to other emergencies. The Rohingya, facing an uncertain future, remained largely dependent on the generosity of others. Their plight underscored the need for sustainable solutions that went beyond temporary relief.
Section 4. The Unseen Scars: Infectious Diseases, Malnutrition, and Mental Health. Beyond the immediate challenges of shelter and sanitation, the Rohingya refugees faced a multitude of health risks.
The overcrowded and unsanitary conditions in the camps provided fertile ground for the spread of infectious diseases. Waterborne illnesses such as cholera and diarrhea posed a constant threat.
Malnutrition, particularly among children, was rampant. Many refugees arrived at the camps already malnourished after their arduous journey.
Limited access to nutritious food exacerbated the problem, leaving children vulnerable to stunting and other health complications.
The psychological toll of displacement and violence was profound. Many refugees, especially women and children, witnessed or experienced horrific trauma.
Post-traumatic stress disorder, anxiety, and depression were widespread. Mental health services, though crucial, were often inadequate to meet the overwhelming need.
The Rohingya, already stripped of their homes and livelihoods, now faced a daily struggle for survival. Their health, both physical and mental, was precarious.
The international community had a moral obligation to address not only their immediate needs, but also the long-term consequences of this humanitarian catastrophe.
Section 5. Beyond the immediate long-term health consequences for all. The health implications of the Rohingya crisis extend far beyond the immediate emergency. Years of living in cramped, unsanitary conditions can have lasting consequences. Chronic diseases, often neglected in the rush to address acute illnesses, are likely to emerge as a significant concern. The lack of access to quality healthcare, particularly for pregnant women and children, will have long-term repercussions. Maternal and child mortality rates, already high, are likely to worsen. Children deprived of proper nutrition and healthcare face a lifetime of developmental challenges. The psychological scars of trauma and displacement can linger for generations. Untreated mental health issues can have devastating consequences for individuals, families, and communities. The Rohingya, already robbed of their past, face an uncertain future burdened by the spectre of ill health. Moreover, the health of the host community is also at risk. The strain on local resources, particularly healthcare facilities, is significant. Competition for scarce resources can breed resentment and tension. Addressing the long-term health needs of both the Rohingya and the host community is crucial for ensuring stability and preventing further hardship.
Section 6. A fragile ecosystem, environmental impacts and resource depletion. The massive influx of Rohingya refugees has had a significant impact on the environment in and around the camps. Deforestation, driven by the demand for firewood and shelter materials, has led to soil erosion and loss of biodiversity. The fragile ecosystem, already struggling, is under immense strain. Water resources, particularly groundwater, are being depleted at an alarming rate. The Rohingya refugees, along with the host community, are facing water shortages. Poor sanitation and waste management practices have contaminated water sources, increasing the risk of waterborne diseases. The disposal of solid waste is another challenge. The camps generate a large amount of waste, much of which is not properly managed. This poses risks to both human health and the environment. The accumulation of plastic waste, in particular, is a growing concern. The environmental degradation not only threatens the health and well-being of the Rohingya refugees and the host community, but also undermines long-term development prospects. Addressing these environmental challenges is crucial for ensuring the sustainability of the humanitarian response and preventing further hardship.
Section 7. Towards a healthier future. Bridging the gaps and building solutions. Addressing the multifaceted health challenges of the Rohingya crisis requires a comprehensive and sustained approach.
While humanitarian aid remains crucial, it is essential to move beyond short-term solutions and focus on building long-term resilience. Improving access to quality healthcare services, particularly for women and children, is paramount.
This includes strengthening primary healthcare, ensuring the availability of essential medicines, and providing mental health support. Community health worker programs, which empower refugees to take charge of their health, can play a vital role.
Addressing the root causes of the crisis, particularly the systematic discrimination and persecution faced by the Rohingya in Myanmar, is essential for finding a durable solution. Repatriation, when deemed safe and voluntary, must be accompanied by measures that guarantee the Rohingyas' safety, security, and basic rights.
Investing in education and livelihood opportunities for the Rohingya is crucial for empowering them and breaking the cycle of dependence. This includes providing language training, vocational skills development, and access to microfinance opportunities.
Empowered refugees are better equipped to rebuild their lives and contribute to their communities. The Rohingya crisis is a stark reminder of the human cost of indifference and inaction.
The world must not turn away. We must stand in solidarity with the Rohingya, demanding justice, accountability, and a future where their dignity and human rights are respected. Only then can we hope to heal the wounds of the past and build a healthier future for all.